Good evening and welcome to tonight's Breast Cancer Now live. This is the Q&A with the clinical nurse specialists. I'm Louise, one of the clinical nurse specialists here at Breast Cancer Now. Just before we get started and I introduce you to my colleague, just a few sort of housekeeping rules really, just to let you know that obviously this is a public forum, so anything you post is publicly there to be seen or commented on. This is just a general Q&A and we really would appreciate any questions, comments. There are no silly questions to ask. So do feel free. Any questions we don't get round to tonight, myself and Catherine will pick up tomorrow and reply to. Alternatively, if you don't want to ask a question tonight and you're just here to sit and listen, but you do want to speak to one of the nurses, our helpline will be open tomorrow morning from 9, although you can leave a message this evening and we'll get back to you in the morning. You can also, on our website, you could do a Ask Our Nurse written inquiry if you wanted to get an email response from us as well. Just a quick plug as well about our survey. We really appreciate your feedback and to let us know what we do well, any topic, what you don't maybe enjoy, but your feedback is really important for us to be able to continue to do these and to do them well. So there will be a link in the comments. It takes a couple of minutes to complete, so we really would appreciate you completing that if you wouldn't mind at some point this evening. So without further ado, I'd like to introduce you to my colleague Catherine. And
Hello.
hiya. And we'll get going. We've had a few questions pre-submitted prior to this. So if we get started with those and then we can go on to any questions that come up during the live. So Helen has asked, Catherine, how can you tell between med side effects and secondary cancer? They seem the same.
Yeah, this comes up quite a lot, doesn't it, on the helpline when people are really unsure. Obviously, the treatments that we use for breast cancer have an awful lot of side effects, multiple side effects, but they can all be very similar to other things. But also, people are worried about whether that's a sign of recurrence and particularly secondary breast cancer. So I think the thing to do is to really clue up on the side effects of the medicines that you're on. So all of the medicines that are used and the drugs that are used for treating breast cancer, you can find on our website. We've got some really good information on each of the drugs, and you may well have been given that written information by your nursing team or your treatment team at the hospital as well. So have a good look through there and know what you might be able to expect, but also just get used to if they start to happen once you start treatment, chemotherapy, hormone therapy, immunotherapy, targeted therapy, whatever it is, get used to those, but also just be aware of how that feels and trust your body a little bit. If it feels a little bit different, then do tell somebody. If we're talking about once treatment has finished, or at least most of your hospital treatment has finished, things like chemotherapy, going in for IV infusions, and you're on hormone therapy, for instance, then that can be a little bit more tricky. So, because sometimes things do crop up, don't they, a little bit later on. You expect to get side effects straight away, and then sometimes they pop up later on. For those with hormone therapy, actually, that can happen sometimes when you get a different brand, if you're using a different band of the treatment. So that sometimes happens as well. I think probably the bottom line is there isn't an easy way to say you can tell by this or by that. Listen to your body. If it is something new, if it is something different, and it's persisting, then we would always suggest that you get that checked out. And nobody, as busy as they are, is going to tell you off for saying, I've got this issue. Is it something that needs to be checked out? What do I do about it? So just listen to your body. Maybe the rule is, many of us have said, I think in clinic, maybe give it 2 or 3 weeks. If it doesn't settle down, then come back to us. So that's sort of a rule, but not a clear rule, but some little bit of guidance to go on with. But it is about listening to your body and knowing what's new and is different for you. So I hope that helps, Helen. But if you want to talk that through on the helpline, then as Lou said, then we're open tomorrow and on Saturday as well, 9 till 1. So 0808 800 6000. And certainly we speak to an awful lot of people who are worried about signs and symptoms of secondary breast cancer. So also really helpful to clear yourself up on those signs and symptoms of recurrence, including secondary breast cancer. And again, we can supply some information. There is that on the website. So we maybe could post that link so that everybody is aware of that as well.
Is that our booklet After Breast Cancer What Now has got the infographic of that in there as well, and it just gives some guidance about what to do again if you're worried, because some teams you can have a direct contact with your breast care nurse with your follow up, and others you might have to go back via your GP. So again, it might be worth, if you don't know what sort of way your follow up is, if you are still in follow up, what that is, then maybe sort of either contacting your breast care nurse to ask, do they get in contact with you, even if you've not got symptoms now, but you know what to do if it happens in the future.
Yeah, it's always useful to have that up your sleeve and know which number and who you're supposed to be asking for to report these sorts of things as well. And we also have another publication that people can find on our publications list, which is Changes to Be Aware of. So that is even more of a succinct sort of list of things. But you're right, the same information is in the other booklet, After Breast Cancer Treatment What Now. So okay, let's move on to something different. A bit of genetics going on here as well. So I think it's Helene. So we've had Helen, and I think that's Helene. I'm really hoping I've pronounced that right. I apologise if I haven't. Are there any good resources or groups for those with rarer genes? And I think she means gene mutations, such as PALB2.
Yeah. So again, it's a really important question, and I think from time to time we hear from people who have got an altered inherited gene, whether that be PALB2. There's other alterations as well, which are much less common. We more commonly hear about BRCA1 and BRCA2, and I think that's probably wherein lies the question. A lot of the support is sort of focused around the BRCA1 and the BRCA2 because they are more common than the rarer genes. But not to say that there isn't support out there for you, Helene. And actually, we've got a peer support service called Someone Like Me, which is is run by Breast Cancer Now, but it's a pool of volunteers and lots of people who have got a diagnosis of breast cancer, but there are also volunteers who haven't got breast cancer. But we have got volunteers. We've got somebody has got a the PALB2 altered gene, so it may be that you can go on our website, or we can put the link in for Someone Like Me. Then they will match you with a volunteer, and you'd be able to speak to them as a one-to-one on the telephone or email. Some of the volunteers offer email response. Most of them do telephone, but certainly that is available to you. The other thing to say is we've got a forum, and on our forum, if you go to the section that says Connect to People Like Me, there is a family history, genes and cancer page. So you could post on there, and there might be other people that you could connect with, and they may be able to support you. There are two, and although I mentioned BRCA, there are two places that you can go for support, and they're actually somebody called BRCA Plus Chat has got their own organisation. They do meetups. Predominantly they are people with BRCA, but the plus is for those people with rarer genes. So it might be that you could contact them and ask, is there sort of particular meetups that have got people who have got PALB2 alterations. And the other place is Future Dreams, which is based in London. They have a monthly meetup, which is a BRCA Plus project meetup. So it predominantly would be more likely to have people with BRCA, but it may also have people with the rarer genes. You also ask about resources, Helene, and we have some information on our website, which again, a smaller amount about PALB, but gene, but there is ways to manage your risk. So if you're considering sort of risk reducing surgery and things like that, then we've got a booklet around managing your risk around different genes and how that's managed. So we can either put that in the link, or if you go on the website, you'd be able to access that. There's a really good American website, which we often signpost to, which has got a lot of information, which is called Force. And that's about hereditary cancer. So it's not just about breast cancer genes, it's about a whole host of hereditary genes, but there is information if you wanted to use that as a resource. And then NHS England, they've got a genomics hub, and again, if you just put in, I think, PALB NHS England Genomics Hub, it will come up. And again, there's a lot of information on there that you can access. So I hope that's answered your question. But again, if you want to call the helpline, we'd be able to give you a much more sort of in-depth talk, and maybe sort of see if we can signpost you on to other things. And also just, it might even be worth, if you're under a genetics centre, is asking them, because they may be local support groups in your area that they know about that you can access if you haven't already done that.
Okay, and the forum, obviously, you can have a look on the website, or just Google Breast Cancer Now forums. So that's obviously online, and directed in the way that you said to the genetics pages. And you can find out more about someone like me on our website as well. So we might be able to post the links to both of those things as well in the chat if you're interested. So okay.
Great.
Um,
So shall I? Do you want? Shall I ask the question to you next, Catherine? Or
yeah, that's absolutely
yeah.
fine.
So Mo has asked, should I be worried if my liver function test comes out with high ALT or and albumin?
Okay. So, Mo, you haven't said whether you're undergoing treatment at the moment or whether you've had treatment. I think, as we said in the first instance, when we were talking about, signs and symptoms and side effects, it's always worrying, isn't it, when you're having or had treatment to know that you've got an altered blood test and your thoughts automatically go to the fact that this could be something, worrying, that this might be a sign of recurrence and that type of thing. But there are lots of reasons for those blood tests, which are predominantly included in liver function tests usually, and those sorts of things are regularly tested when you're going through treatment, and for some people after treatment as well. So lots of things that can affect those two measurements of that blood test. Things like hormones. We often think about liver enzymes and alcohol. That's not to say that people can't drink alcohol, and we're not insinuating anything else, but sometimes that has an impact. Herbal supplements can have an impact as well, and then medication. So quite a few of the medications, I didn't go looking specifically, but quite a few of the drugs and the medications that are given to people when they're having treatment for breast cancer, like chemotherapy. Your liver works really quite hard to process chemotherapy and get it out of the body once it's done its job. So there can be alteration of those liver enzymes, those liver blood tests, and results because of that. You don't say whether you've got any symptoms, and I think sometimes when you've got an altered blood test, then if your GP or your treatment team know that, then they'll be asking about whether you've got any symptoms and that sort of thing. And sometimes things like dehydration can cause a change in those as well. So it depends on how much it's raised by as to whether it's worrying. So it really is quite difficult to give you a succinct answer there, Mo. But there are lots of different things. It might help if you ring and chat this through with somebody on the helpline so that you can give us a little bit more detail, and then one of the team members can give you a little bit more help. So lots of reasons. Understandable that you're worried. Lots of different reasons for that to be altered, but maybe a little bit more detail might help us give you a better answer to that, or a bit more detailed answer. But I'm sure that your team are going to be looking at that, and if that they're aware of that. If you don't think they're aware of that because you've had a blood test for something completely different, nothing to do with your breast cancer, then it would be helpful for you to let them know that you've had the blood test and what that is, so that they can review it alongside the rest of the information that they have with about you, and make a decision as to whether they need to see you and check you out. We've got a live question in, Louise, so from
Yeah.
Debbie. So that'd be quite good at this point if we could probably address that. So Debbie says, I had a lump and lymph nodes removed in June. My breast is still painful and the skin feels like leather. I saw a GP before Christmas, but she'd never seen anyone before who had breast cancer. I requested to see my GP again last week, but I've still not been given an appointment. So this sort of thing is quite often brought up on the helpline, and isn't it, when people have got changes to the breast, and I assume that having had a lump removed, then probably Debbie's had some radiotherapy, and both those things can affect the way that the breast feels and looks.
Yeah, so certainly, I mean, yeah, absolutely. I understand sort of why you're asking that question. It's really important that you do get that assessed, and it's a shame that GP maybe hadn't seen anyone with breast cancer, so wasn't able to sort of signpost or offer any sort of support for you. I think, yeah, as Catherine said, if you had your surgery in June and possibly you haven't said, but it's likely you've had some radiotherapy along with that. It could well be changes from the radiotherapy that's causing the the skin to feel like that, but it shouldn't feel that. I mean, we know that radiotherapy can cause changes and hardening and thickening to that skin, but certainly, I mean, and again, it's really difficult to say what it could be without seeing it. You need to be seen probably by the breast team. So again, I don't know if you were listening before, Debbie, when we were saying that it might be worth, if you are able to contact your breast care nurse, if you are still under follow up with the hospital, to sort of say what are the next steps. The breast care nurse, even if you've been discharged, will be able to say you've got to go back to your GP and get a referral back in. But I think the breast surgeon probably needs to see you initially, or someone from the treatment team, whether that's if you've had radiotherapy, somebody from the radiotherapy team. Again, not that we can say whether it is, but if you've had lymph nodes removed, sometimes you can get sort of a swelling in the breast, and possibly sometimes that can go on to be something called lymphedema. So it is really important that you don't leave it and that you get it assessed, but we can't say what it is, but somebody needs to look at that. And if it is that you need to get an appointment from the GP and you can't get an appointment, even going to the breast care nurse, just giving you that leverage to say, I've spoken to my breast care nurse and she says I need to be referred back in, if that's what you need to do. Or again, it might be worth having a call with us on the helpline tomorrow. We can talk it through in a bit more detail, get to know a bit more information about where you're
Yeah.
at with everything, and signpost you and give you the support you need to get that assessed. But I think somebody in the breast team needs to see that, and then can tell you what the cause possibly is, whether it is normal healing changes that you're going through, or whether it's not and something needs to be done.
Yeah, okay. And I think an awful lot of people, again, get worried about the fact that this might be something that is starting to happen again, that the breast cancer's coming back. But we know these signs and symptoms really tend to be side effects of treatment, usually, like you mentioned, lymphedema and just the effects of radiotherapy on the skin. Sometimes people do pick up infections as well. So Debbie's not said that it's red, but she has said it is painful. So yeah, absolutely right to get it checked out and get somebody to give you some expert advice on that and what needs to be done, and how they can help you with that. Okay, so we had another question in before we came on air this evening. Lymphedema is another thing that comes up really quite a lot, doesn't it? And people are really very worried about developing lymphedema. We know that people who have lymph nodes removed to any extent, whether that's a full lymph node removal, dissection, or whether it's a handful of those or one or two of those as part of a sentinel node lymph node biopsy, as we call it, then they're worried about developing this. So Irene asks, how can I prevent lymphedema on a long haul journey? I presume she means a long haul flight and in a hot country. It sounds like she's put TLND, but I think that's total lymph node dissection.
Yeah, that's what I took it to mean. So, and I suppose for anyone who's watching who's not sure what lymphedema is a swelling caused by build-up of fluid in the body's tissues. And some people, as Catherine said, will develop lymphedema or can go on to develop lymphedema after surgery if you've had lymph nodes. Either that's all of your lymph nodes, which sounds like in Irene's case, she's had all of her lymph nodes removed. And sometimes with radiotherapy as well, you can have that to the lymph nodes under the arm or the breast. And when they're removed, it means that they're not able to sort of work as well as they did. So the lymphatic system's ability to drain that fluid is less effective. And people then are at risk of that fluid. And usually it is in the arm, in the affected arm where you've had the surgery. It can also affect the breast. And as you say, Catherine, I think a lot of people are left with that worry after they've had a breast cancer diagnosis, and it's understandably that risk is lifelong. So it is about sort of knowing what you can and can't do, and we've got information on our website, but certainly from a point of a long haul flight that Irene is talking about, that we don't say prevent, because you can't prevent things, but you can reduce the risk of things happening. So that what we would generally say is that is no worries about going on a long haul flight, but it's just about taking precautions really, and drinking plenty of fluid, hydrating, which is what we would probably say to most people.
Yeah.
And then being mobile throughout that flight, so not sitting in that same chair for the whole of the flight. I know that's difficult on a long haul flight, but it's getting up at regular times and then just sort of maybe moving your wrists, moving your arms, moving your shoulders, lifting your arms up, and just having some movement so you're not sat in that one position for the whole of the flight, really. So that's really it for the long haul flight. When you get there, and if it's a hot country, the advice or the information we generally give, and again, treatment teams should be able to give this, and we've got information on our website. We've got a booklet called Reducing the Risk of Lymphedema. So again, you can have a read on the website, you can access all of that information. But what we would generally say, again, advice we'd give to everyone, if you're going to a hot country, you don't want to get sunburnt, because any injury, so if you were to get sunburn, you could potentially cause an infection in the arm that may go on to be lymphedema in the future. If there was insect bites, so mosquitoes in a hot country, it's about wearing insect repellent as well. If the hot country you're going to is a bit more remote and you don't have access to healthcare readily available, that you could get some antibiotics in the event that you got a cut, scratch, injury that you were worried about that was going to get infected, sometimes people go to their GPs and they'll take a course of antibiotics as a precaution on holiday with them. So it's just about sort of being prepared, so maybe having your insect repellent, your antiseptic cream, and if it's much more remote, taking a course of antibiotics if in the event that something was to happen, you've got something there to take. Again, if you were somewhere you got a mosquito bite that looked like it had become infected, it is about getting that seen sort of quickly, starting some antibiotics, and then if you're away for maybe 2 weeks, if there is a swelling that's noted within that, it's about going getting that assessed with your breast team and whether or not that needs an onward referral.
Okay, lovely. So yeah, being really careful when you're out there in the hot weather, but in enjoying your holiday as well, and just keeping things moving. You know, whether you're sitting reading and you're sort of swiveling your wrists and your arms around, it is about keeping that fluid moving, isn't it? And sort of then not being that sort of static sort of time where you're sitting there. So yeah, all of those things. And as you said, that tends to be the type of stuff that we tend to tell people anyway about travel, isn't it? Maybe not the taking the antibiotics with you, but everything else really people need to be aware of as well. So we don't look as if we've got any other questions in at the moment, but it might be a good idea just to sort of say to people who are watching that, you know, the survey that Lou mentioned at the beginning, we're really, really appreciative of everybody that fills that in, and it gives us good ideas and prompts us to think about ideas for these Facebook Lives and the topics. So if you've got anything that you do that suddenly comes to mind, I wish I'd really talk about that, then please can you let us know. We've done lots of Facebook Lives in the past and covered services and bits and pieces, so we'll wrap up with a little bit of services prompting before we finish. But we have got another question in, so thank you, Tracy. Tracy says she had a breast cancer 5 years ago with a left mastectomy, no reconstruction, and she's on tamoxifen for 10 years. And now it sounds like she's got recurrence. Now it's recurrent. So I'm really sorry to hear that, Tracy. That's a really difficult time for you at the moment, to hear that your breast cancer has come back. You don't say where it's come back, but obviously, you know, you might find it helpful from a support point of view to speak to one of the nurses on the helpline tomorrow or in the next few days. You've not said about any change in treatment and what's going to happen. Maybe you don't know at the moment, but sometimes when you're in that middle land where you know the diagnosis and you know what's happening, but you haven't got a treatment plan, can be a really difficult time because you're not really sure what's going to happen and when. Just had no chemo, just radiotherapy, and that's a really common thing to have. Tracy, is, you know, a lot of people from their risk for the future, although you can never be certain exactly what's going to happen to people, is that they've had their surgery, usually have radiotherapy if they've had a lumpectomy or what we call a wide local excision, but some people have it with a mastectomy as well, and as you did, without any reconstruction. And then you have the hormone therapy to reduce your chances, but we never know for certain that treatment is always going to be 100% and is definitely something that is going to stop that breast cancer coming back. So it sounds like you might be in a little bit of middle ground there, and thinking about, what type of treatment is to come. But I'd really encourage you to give us a call, Tracy, and talk that through. We've got the luxury of time on the helpline to be able to spend with people, talk through it, and just talk through how it feels to be you at the moment, and your thoughts and your feelings around that, and maybe questions that you want to ask your treatment team as well. So please give us a call, 0808 800 6000, and we'll be open at 9 o'clock tomorrow till 4. But as Louise said at the beginning, we've got a voicemail facility, so if you'd like to say, yeah, I'd like one of the nurses to give me a call back tomorrow, Tracy, ring the helpline this evening. Once we've finished, leave us a message and your number, and one of the nurses will try and give you a ring back tomorrow morning.
Great. And Irene's just come in and she said, thank you so much for this advice. Flying on Sunday. We'll have a lovely holiday, Irene. And I think we should talk about the do's and don'ts after lymph node clearance as a topic. Nobody tells you that.
Okay. So
I presume sort of it's around the risk of lymphedema and that you're worried about of what you shouldn't do, should and shouldn't. Yeah.
Yeah, that makes sense.
Not engaging. So it's sad to hear you've not been given that information, Irene, and really that should be sort of when you've had lymph node clearance, your treatment team in an ideal world should talk through about what you can and can't do after that. I think there's a lot over the years that's changed, and there's a lot of information that didn't exist. So we probably erred on the side of caution and sort of said, don't do that. So lots of people are worried about, should they be gardening? Should they be doing this? Should they be carrying heavy shopping? Should they not be going back to exercise? All of those things that actually we know now are okay to do. So I think, and again, certainly when I was a breast care nurse, that's the advice I was telling my patients. It was, don't have a blood pressure on that arm, don't have blood tests, don't have injections in your arm. So and we know now that there's no consistent evidence to say that will go on to cause lymphedema. So actually, and lots of people still choose, if they've got an alternate arm, they'd probably say, well, actually, I know the information, but I'd rather give that arm. But the evidence is not there to say that it increases the risk. So and again, we still hear on the helpline, don't we, my treatment team say avoid that arm afterwards if you're having blood pressure, blood test, injections done. So I think, and again, it's all in the information. It's in the booklet. If you do, we'll try and put that link out there, reducing the risk of lymphedema, and that has got all the up-to-date information. I think the other thing there is around, we often hear from people who say about hot tubs, swimming, saunas, going to have massages, and it's again, you can do all of those, but it's certainly, if you go to have a massage, I think it's about sort of, they'll ask you about your medical history. They might want to avoid that arm if they're not qualified to give a massage in that area. If they feel comfortable to do that, they will know what to do and apply the right pressure. But I think it's that, again, it's really important that have a read of the information and do that. With regards to the gym, there's no reason, if you would go into the gym, or not even going to the gym, but physical activity, exercise, lifting weights, whatever you did, if after the surgery you have stopped doing them, as long as you gradually introduce them back in, there's no reason why you can't get back to what you were doing before then. Is there anything else I've missed off of that, Catherine, that we would suggest?
No, I don't think so. I mean, it is that whole, most people will choose their other arm, won't they, when to offer that for a blood test or for a drip in and that sort of thing. It seems, just some people seem to sort of just go with common sense and do that. But, in the instance where you've done that, you've worried, you have had an injection, or you've had to have, your blood pressure taken on that, a lot of people worry about that, and there isn't that evidence there. So we can sort of reassure people that there is nothing definite. If they want to choose to avoid that arm and offer their other arm, then that's obviously is absolutely all right. But it is about being sensible. We know that an awful lot of people are really, really, really worried about this. So it's trying to find the balance of enjoying life and then just doing what you can to reduce your risk. So reading the information that we've got in the booklet and also on the website, and coming back to us and talk that through on the telephone if you want to do on the helpline, then you can do that as well. I think Irene was suggesting that we should have that as a topic from a survey point of view. So Irene, I'm hoping you can fill in that survey. And I think we talked about it before, but it's always good to repeat these things and invite an expert on and have that discussion about lymphedema. So we'll note that one. But if you pop that in a survey, Irene, we'd be really grateful. Yeah. Lynn is actually continuing that discussion about lymphedema, but actually goes on to say that she's got a recurrence of breast cancer. I think, it's also important to say that sometimes people do have lymphedema because of a recurrence of their breast cancer.
Yep.
It's that blockage in the lymph nodes and the lymph system that can cause that. She says that she's got a recurrence of her breast cancer in an armpit and neck and collarbone. So it does sound like that she's got her breast cancer has come back again in those lymph nodes. She had radiotherapy, which has increased her my lymphedema. So again, we know that radiotherapy can have an effect and make lymphedema or increase your risk of lymphedema. Sounds like she was suggesting that she's had radiotherapy alongside at the same time as she's having had lymphedema as well. So that might make that worse if that is the case. Now having chemotherapy and immunotherapy and worried, and that's totally understandable, Lynn. It really is. When you've been through so much before treating your primary breast cancer and then it's come back, it really is a very big shock to the system and is really very overwhelming, and it's difficult to know where to turn to get the support that you need. But breast cancer now, we've got an awful lot of support. So again, if you want to talk through the sort of support that's right for you that we offer or that is elsewhere, we do a huge amount of signposting to other organisations, other charities, back to treatment teams and those sorts of people. Then it's important to get the support and the care that you need for you, and only you know what you need. So talking that through in a little bit more detail with one of us, we'd be really happy to do that. So whether you want to give us a ring on 0808 800 6000 tomorrow and talk that through with one of us, or even Saturday morning or next week, you can do that. But again, as we've said to others, if you want to leave us a voicemail this evening with your name and your number, one of the nurses will try and give you a call back. And you did mention earlier about our Ask Our Nurses, I think, right at the beginning. That service as well, the written inquiry service. That means if you go onto the website, you look for Ask Our Nurses, you can fill in a web submission. Tell us a little bit about yourself. Tell us what you're worried about or ask your question, and we'll send you a private response to that. But also you're asked in there if you quite like one of the nurses to give you a call back in there, so you can give us a bit more information. Also give us your permission to give you a call back with your telephone number as well. But obviously you can continue to ask us questions on social media as well, and they come through to Ask Our Nurses as well. So it just depends on how you want your answer, really, as to how you contact us as well.
And I suppose just one question which we don't know, and I hope you've been sort of referred to a lymphedema specialist, Lynn, just around that. It may be that you have and you're getting the support for the lymphedema, but if you're not, then again it might be worth asking your treatment team for a referral to a lymphedema specialist.
Yeah, definitely. No more questions in at the moment, but it might be worth us just sort of plugging a few of the services that we have got. We've got we've built up quite a few speakers live sessions now, haven't we? So they're for people that don't know what they are. They run alongside our supportive services, really to deliver information to people who've been affected by breast cancer. They're going through or they've gone through treatment. So there are two sets of speakers live. So we need to make sure that you get the right ones. So those for primary breast cancer. I think you had a look at the topics that are coming up for that one, didn't you, Louise? Do you want to just let people know what's going on?
Yeah, there is coming up this month, and I think there are more, but the next couple that are coming up, there's one on breast reconstruction, and it might not be relevant to anyone on the call, but if it is, then certainly that's with a breast plastic surgeon, reconstructive surgeon. That's on the 11th of March, and then there's one on the 27th of March with Dr. Isabel White, which is on sex and intimacy, and we know that treatments for breast cancer and just having a diagnosis of breast cancer can really impact on relationships, particularly sex and intimacy. So that may be one that you want to watch. There is also one on physical activity coming up, I think in April, and one on dealing with worrying thoughts as well, which is again I think is not until June, so it's a little way off yet. But do have a look at our, if you put in speakers lives, that will come up for the primary ones anyway. So do have a look if you are interested in joining one of those.
Yeah, okay. And there's also speakers' lives for those with secondary breast cancer, so incurable breast cancer. So that's breast cancer that's spread to another part of the body, and we know that we can't cure that. The two pages do look different because at the moment the primary breast cancer speakers live has got pictures and sort of little biographies of those of speakers. We're not quite rare with that web page for the secondary, but nevertheless those speakers' lives are still there. So if you go to the Living with Secondary Breast Cancer online page, then that describes the expert speaker sessions or the speakers live sessions as part of the online services that we have for secondary breast cancer. And there's quite a few of those. So we've got some younger women's services, so younger women with secondaries together online. And we've also got about 6 groups, online group that meet during the month at different times during the month as well. If you scroll down to the bottom, there's a few FAQs. And at the moment, the titles of the upcoming and probably recent ones, there's a couple of them there that have been and gone. They're the titles on there and the topics are on there. So we've had one recently from the beginning of year about secondary breast cancer and travel insurance specifically, and we are actually going to be doing a Facebook Live on that. So Fiona McRae will be joining me at the beginning of April. I think it's the 3rd of April to talk about that secondary breast cancer and travel. We've also had one on oral care and dentistry when you're living with secondary breast cancer, which again, both of those things were actually really well attended. Just tells us how much information people do want to know and how interested they are. And coming up in next month, so we're nearly in March, can't believe it, is Talking to Children, which comes up an awful lot, I think, in our groups, and particularly with our younger women when they've got younger families, just about dealing with younger children and their questions and queries about the future when mum or dad is living with secondary breast cancer. So we've got somebody coming along from the Rees Strauss Foundation to deliver that. And we've also got one in April about end of life care and palliative care, because an awful lot of people have got questions about that and they can't really get the answers to that. So we've got some wonderful nurse specialists, palliative care specialists, nurses coming along to deliver that session as well. So yeah, just look out for those sessions and you can pick and choose what you feel you're ready for, what you're interested in, what you feel you need more information in, and you can just register. It'll give you on the web page where to register so that you can make sure that you can register for that session and know what's coming up in the future as well, in case that's of interest or help to you as well.
Great. There's one last Sarah's just asked. I think we'll answer this quickly, and then I think we're sort of nearly to time. But Sarah's asked, I've got a hard lump where I had the lumpectomy. Is this normal, please? You don't say how long ago the lumpectomy was, Sarah, but we do know in the weeks and months afterwards it can feel very different. There can be scar tissue, there can also be swelling if it is in the week, something called a seroma that can make it feel sort of harder than it was before, and very rarely there can be sort of something called a hematoma which can also make it feel. So it depends how quickly or how soon your surgery, how long ago your surgery was. If it's been many months or you're sort of further down the line and you have noticed it feels hard and it didn't before, as we said right at the beginning, I don't know how long you've been listening, if you've been listening, any new changes that you have noticed, we would always say if they're new, persistent, and it's got no known cause, you're not quite sure why it is, don't hesitate to contact your treatment team about that and say, I'm not sure what this is. They are, and as Catherine said at the beginning, even though they're busy, that's what they're there for. They are there and they won't think you're wasting their time. If you ring up and say, I'm not quite sure about this, they'll either talk you through, depending on the stage and when you had your treatment, as to whether or not it's normal healing, it's normal part of the sort of healing process, or whether it's something they need to get you in, check it out, assess you. So certainly it's worth, or if you want to, again, as we've said many times throughout tonight's live, if you want to give us a call in the morning, talk it through in a bit more detail, and then we can talk through what the next steps may be.
Yeah, definitely. Yeah, it's just so hard to know, isn't it? And we don't expect everybody out there that has gone through anything to do with breast cancer and treatment for breast cancer to always have the answers and know which to go. So, you know, which way to go. And that's what we're here for, to ask those questions, however you want to do that, through social media, through the website, through the helpline. I know we've plugged that quite a bit, but there are several other ways. On Instagram, we get messages through Instagram, both publicly and privately, Facebook as well, and Twitter, or as formerly Twitter, X, whatever it is these days. You know, all of those routes people choose to contact us, and it will be the same people and the same service. So please do give us a call. So any of you that have asked questions this evening, or if anybody's sitting out there thinking, I don't want to type, this is a public area, you know how to get hold of us now and to ask those questions. We're here to give you support. A quick reminder for people about that survey. We've said it a few times already, but we're really, really grateful for people filling in the survey and just giving us some idea of what else you want. These sessions are for you, and we want to make sure that they meet your need. It's great to have question and answer sessions like this. It gives us a little flavour of what people are wanting to know, and they bring up their queries and their concerns as well, but some really good topics for the future. Suggestions would be great. So I'm hoping that Irene's filled in that one about the lymph nodes as well.
And it's really easy to fill in. It's not a lot of text. I mean, obviously we are asking for some of the suggestions, but a lot of it's there for you. A couple of minutes and it's done. But we really would appreciate it. It just allows us to continue doing these, and for you guys listening to get the most out of them, really.
Yeah, so the link's in the link will be in the chat underneath this video. So if you can have a fill in that and have a look for that and fill it in, that would be great. And also just to say that if you want to ever go back, we know that these Facebook Lives sit on our Facebook page, but we've also got a YouTube channel. They're called Breast Cancer Now Chats. So if you want to have a look on the YouTube channel, you do have to scroll part way down the page to find us, but you'll find all of us nurses. We've all partaken in these Facebook Lives, have some wonderful guests, and some Q&A sessions. You can go back to have a quick look at those as well if you wanted to go back and look at answers. So lots of information, lots of support. We're here for you. I think that's all I need to say this evening. I think we've said lots about the helpline, 0808 800 6000. I'll say it again. And if you want to leave us a message, you can leave us a voicemail anytime. We'll get back to you. But I think I'll say goodbye for now, Louise, and I'll see you at work tomorrow.
Yep. Goodbye, everyone. Good night.
All right.
See you tomorrow, Catherine.
Yeah.
Take care.
Good
Thanks for
night.
joining.
Bye-bye.
Bye.